agree with the professor that there are a few points in this bill which are good. And one is the elimination of pre-existing conditions. Another one is putting a cap on the lifetime amount of money that insurance companies will cover you for illnesses and diseases. There are very few really good things in this bill. Those things can be passed by a mandate. They don't need to have a whole new government takeover. The federal government could have a bill. They can tell the insurance companies, they can say, they can regulate them. Insurance companies are regulated by federal regulators and state regulators, that you can no longer deny insurance because of a pre-existing condition. I'm in favor of that. That could be done, and I would support that. The problem is you cannot let the government take over the whole system and run it entirely, because then what it does, it just dilutes out everything and just spends money. We need to keep the free enterprise system intact. We need to use alternative ways of lowering health costs and then use some regulations on the insurance companies that keep everybody honest. So we need to have these buying pools. Buying pools increase the numbers of people that are competing for the insurance. The federal government has very inexpensive insurance. That's why these congressmen and senators get such good insurance at a low cost, because they have millions of people in this pool. We can create pools of individuals like you folks, your parents, small businesses, into bigger pools, and then you can buy insurance cheaper. And there could be a mandate saying that you have to sell to everybody. You can't restrict because of a pre-existing condition. We can do things like health savings accounts, which allow you to put money away into a private fund and then use that money for your medical expenses up to a certain point until you run out of money. Then you can have a catastrophic policy on top of that that will cover you for the really big expenses. And that catastrophic policy is very inexpensive. So you can do that, and a lot of your parents probably do that as well. So there are ways that we can attack this problem, that we don't need the government to just say, we're going to take it all over and do it all for you, because that's not going to work. So I agree with the professor that there are a few good things in there, but we did need this bill to accomplish them. They can be accomplished very simply with some federal mandates and some laws, and then some regulations on the insurance company, and then we address the root of the problem, which is the high cost of insurance and the lack of affordability of that and accessibility. And we can do that through the free market and not through the government takeover.